Okay, I think we will get started. I know others will continue to join us. Can everyone hear me okay?
Yes, we can.
Okay,
Yes,
great, thank you. Okay, good morning and good afternoon. My name is Tijuana James, and I'm the Senior Youth Advisor in the Youth Branch of the Office of HIV and AIDS. I come to you with over 25 years of experience working with and on behalf of adolescents and young people. So I am indeed honored to be moderating this session today entitled, "It's Time to Rethink: Targeted Approaches to Engaging and Meeting the Needs of Adolescent Girls and Young Women, Youth, and Dreams Beneficiaries." Before we begin, I would just like to note for the audience that you should feel free to enter any questions you have into the chat, and we will have a Q&A session after all the presentations have concluded. So thank you again for joining us. Regardless of where you call home, each of us has at least one shared experience. That experience is having been an adolescent. How you experienced adolescence probably varies greatly, but most of us can recall periods of uncertainty, fear, and frustration. But we also likely experienced hope, promise, and excitement. It was during these times in our lives that we were perhaps the most creative. The programs you will hear about today are in part the result of the creativity of young people. These programs have taken a bold step to involve youth in identifying their own needs, as well as the approaches and strategies for meeting these needs. Please join me in welcoming our three panelists today. First, we will hear from Warona George. She is a youth advocate for the rights of children and for increased access to comprehensive sexuality education for AGYW. Warona currently works at Stepping Stones International, an NGO focused on youth empowerment and dedicated to building an HIV-free generation. At Stepping Stones International, Warona works as the mentor supervisor, overseeing the implementation of the DREAMS program. DREAMS works to prevent HIV and empower adolescent girls and young women. Warona has always been interested in helping her peers and those younger than her to become more knowledgeable about and prepared for opportunities to enhance their skills and advocate for their rights. She has a keen interest in personal and career development for AGYW in order to reduce the socioeconomic and mental barriers that sustain the gender pay gap and gender inequities. Warona is also passionate about criminal justice and working towards eliminating gender-based violence. She will be followed by Sister Mary Owens. Sister Owens is an Irish national and a member of the Loreto Sisters. She is currently the executive director of the Children of God Relief Institute. Sister Mary came on mission to Kenya in 1969 and spent the first 18 years of her missionary life in formal education in Loreto schools. In 1987, she returned to Ireland to do her master's degree in education at Trinity College, where she specialized in psychological counseling. On her return to Kenya in 1989, she met Father Angelo D'Agostino, and in 1991, together they established the Center for Religion and Psychiatry. It was during this period that Father Agostino felt the call from God to found a home for HIV-positive abandoned children, and Sister Mary joined him in this founding. Over the next 29 years of its existence, Kogri has grown from a small home for HIV-positive abandoned orphans in 1992 to developing a laboratory and community-based care program called Lia Toto in 1998, to establishing Numbani Village in Kitui District in 2006, where they provide outreach to groups of children orphaned as a result of the HIV/AIDS pandemic, and providing services to destitute grandparents. And lastly, we will have Alejandra Cabrera. She is the Regional Strategic Communications and Marketing Manager at the Pan American Social Marketing Organization. She has been with PASMO for the last 13 years. She is currently responsible for strategic communications, including donor reporting, work plans, proposals, success stories, as well as marketing communications for PASMO's brands, channels, and campaigns. Ms. Cabrera obtained her bachelor's degree at Wesleyan University in Connecticut and completed courses for a master's degree in marketing at the University of San Carlos in Guatemala. At PASMOS, she has led training workshops for staff and external partners across the region in areas such as media and crisis management, storytelling for success stories, writing donor reports, and HIV sensitization workshops for journalists, among others. You will note that we have an experienced panel of presenters today, so please join me in welcoming our first speaker, Rowena. Over to you.
Thank you so much, Tijuana, for welcoming me and welcoming all of us panelists. Hi, everyone. As she said, my name is Warna, and I am from Stepping Stones International in Botswana. Yes, Lindsay. Today, I will be discussing the Dreams Library Corners. This was an initiative that we started during COVID. And the way it came about was that we had the Dream Safe spaces that were running in schools in our community. And in these safe spaces, this was a chance for adolescent girls and young women to meet with their mentor and have a safe space where they could express their views, opinions, and thoughts and feelings to their peers, and also receive guidance from their mentors. This was also an opportunity where they got to share experiences and be connected with opportunities through sharing life stories with their peers, and also receiving coaching and mentoring from their mentor. However, with COVID and the restrictions that we had during COVID, it made accessibility to this safe spaces and the services that we offer very difficult for youth in Botswana. We could no longer meet in schools, and we could no longer physically meet in the communities, which means that a lot of information was only accessed virtually. And with many people, or many young people, not having access to smartphones, this made accessibility to information and services difficult for the AGYW that we serve. And that is how the idea for the Dreams Library Corner also came about. Next. So the Dreams Library Corners was a space designed with and for adolescent girls and young women. So as Stepping Stones International and the Dreams Ambassadors in our district, we designed a space that allowed for access to information about clinical services and social assets that we offer and that are offered in their communities. These library corners were open in the local schools we work in libraries, and will be expanded to youth centers as well. So in these corners and these spaces, there were pamphlets, magazines, flyers, and books that were provided that related to the needs of an adolescent girl and young women. This became a space where adolescent girls and young women and members of the general youth could gain information about where to access clinical services, information about social assets, how to navigate life as a young person, and where to go when you need support or help. The information learned from these corners could also serve as a springboard to start conversations in homes, in communities, and in their schools, amongst their peers, amongst their teachers, and their family members. So if an AGYW was able to take a pamphlet or take a flyer home and then discuss it with their parents, discuss it with their siblings, or discuss it with other members, other peer members, this was able to open up the conversation about HIV prevention and care, gender-based violence prevention and care, and learning how to build those social assets that helps a young person navigate life. In addition, the adolescent girls and young women were involved in the setup of these spaces in their communities. So in the schools, we would have AGYW and who were confident and vocal to help with setting up these spaces in their schools and also maintaining these spaces in their schools. Next, please. The Dreams Library Corners also became spaces where the adolescent girls and young women could claim as their own. So due to the COVID restrictions and us not being able to serve our communities the way we wanted to, in schools, this became a space where the girls could have their own meetings and their own safe spaces that they could feel ownership of and also maintain the corners. This could become a space where they met up for their own safe spaces, where they shared information with each other, and that they were also able to have these conversations whether we were around or not. We also appreciated that, AGYW also appreciated that this was a space where information was easily accessible to them. So they wouldn't have to have a smartphone or a telephone at all to reach us or to reach these services or to find out where they could find links to clinical services that would help with HIV prevention and care, or just learn about their sexual health and their sexual rights. This became a space that was easily accessible to them where they could get that information as well. And we also found that having this space increased the Dreams visibility in our communities. So having a space that was in the schools also allowed for parents, caregivers, and the members of the school community to understand what the Dreams Project is about, to understand that the goal of Dreams is to make sure that we build bold, strong, and resilient, healthy young women that are able to reach their goals and lead towards an empowered HIV-free generation. This also helped to start conversations and increase buy-in of the Dreams program in our communities as the stakeholders we worked with and the places where we set up these Dreams Library Corners were also able to see the importance of having such programs and such spaces where young people could feel safe and feel also that they were able to access information that related to their health and their well-being. The Dreams Library Corners also provided a platform in which there could be collaboration between organizations that serve the youth. For example, some of the books that we set up in these corners and the flyers and the magazines came from different organizations that have different mandates to serving the youth. For example, we had organizations donating books that are from places that are focused on the LGBTQ+ community. We had organizations who donated materials who focus on the needs of the boy child and empowering the boy child. So having all these different sources of information also helped to create an inclusive space for all AGYW and members of the youth so that any person who accesses these corners or is able to receive a pamphlet or have conversations in these Dreams Library Corners feels that whatever gender they are, whatever identity that they identify with, they are also included and able to enjoy the benefits of the information that is accessed. Next slide, please. So in future, the way we see the progression of these library corners is that we would like for, or we're having the AGYW that we work with design and maintain a suggestion box to improve the corners and improve the sessions that they have there. So this will be a box where they're able to write notes anonymously and ask questions or provide recommendations of how to make things better or recommendations of things that they would like to see in the corner. The reason we are advocating for a suggestion box is that this also allows anonymity for students or members of the or AGYW who may not feel comfortable vocally asking for these things. This also maintains that the space is for the AGYW and also maintained by them, because having it as a suggestion box allows them to govern when we come in and help them or how we interact with them. But they are the leaders of that space. We also recommend that in future, these library corners are expanded across the districts in Botswana, and that in that expansion, we have the content translated to the local languages that are used there, and that also that the content is contextualized. So when we are providing context or locations for clinical services or social work services or any other services that an adolescent girl or young woman might need, that these are specific to the context that the girl is in, or whether it is that community, whether it is that district, or whether it's a specific village, that the contexts are all specified for each place that we expand to. This would promote the DREAMS mandate towards having an HIV-free generation across Botswana. One thing that we will be monitoring is whether having this increased knowledge of clinical services or increased access to information about clinical services and social asset services, will this then translate to an increased uptake of clinical services towards HIV and GBV prevention and care amongst adolescent girls and young women? And lastly, we hope to see increased collaboration with youth-friendly clinics and nurses across the district, so that the library corner can also be a space where adolescent girls and young women can feel free to access clinical services and knowledge from health professionals. And lastly, next slide. Yes, so in conclusion, the purpose of the DREAMS Library Corners is to provide adolescent girls and young women with accessible services and information to the services that they need as a young person. We initiated this as something that reduces the barriers to having access to this sort of information. So a young girl does not need to have a cell phone to be able to access information, even in times where there is reduced physical contact due to COVID or any other pandemic that could affect us. This is an idea that is always up for adaptation, meeting any circumstance, but the point of the DREAMS Library Corners is to see that we are empowering the youth any way we can by having them, by building accessibility to services and information, no matter what the circumstance is. So thank you very much for listening to my presentation today.
Thank you so much, Warona, and what a great example of what young people can do when we as adults get out of the way and give them the space and the freedom to do so. So thank you so much. Next, we'll hear from Sister Mary Owens. Thank you. Sister Owens, can you hear us?
Sister Mary, if you're speaking, you're on mute. So would you be able to come on camera and speak?
Thank you. Greetings to all who are gathered here today for this presentation. My name, as you heard, is Sister Mary Owens, and I'm presenting on behalf of our team in our community-based care program, Lea Toto, which is one of 4 programs in our institute, Children of God Relief Institute. Next. Next.
Sister Mary, it doesn't look like your video is on. So would you like to put your video on for the presentation? Perfect. There you go.
Is that all right now? Is that okay?
Yes, thank you. I'll go to the next slide.
Thank you. So the outline of the presentation is the background of the program, the description of the actual care strategy, then results and discussions and conclusion and recommendations. Next. The Leo Toto program, as I said already, is a community-based program which was established in 1998. It provides comprehensive care and support to children and families infected, affected by HIV in 8 informal settlements of Nairobi: Kawangware, Kibera, Kariobangi, Dandora, Zimmerman, Kangemi, Dagoretti, and Mukuru. Currently, the program serves more than 12,130 orphans and vulnerable children infected or infected by HIV through provision of healthcare and nutrition, psychosocial and spiritual support, OVC care, household economic strengthening, and adolescent care. The photo there is of our founder, Father D'Agostino. Next. In 2014, Leo Toto partnered with the Community Health Asset Mapping Program, CHAMP, formerly known as Mukuru on the Move, to conduct a survey on challenges facing adolescents who are infected or affected by HIV in Nairobi City County in Kenya. Age, negative peer pressure, mental health issues, drug and substance abuse, and poor parental guidance were all identified as major challenges affecting adolescents. In addition, the survey revealed that adolescents living with HIV were confronted with issues of stigma, delayed disclosure, forgetfulness, pill burden, school issues, and insufficient support structures. These issues contributed to their having low self-esteem, withdrawal and lack of self-drive, poor adherence, and viral viral non-suppression among adolescents living with HIV. Next. So, to address the problem of poor viral suppression and other issues affecting resilience of adolescents on care, Leo Toto established an adolescent program in 2017. The goal of the program was to address the challenge of poor adherence and suppression, and to facilitate provision of a comprehensive education on sexual and reproductive health and rights. And we would do this through training peer educators, building the capacity of parents and caregivers, giving the adolescents comprehensive life skills training, mentorship and rite of passage, and finally transition to adult care. Next. So we identified a pool of peer educators. Actually, they were former members of the Leo Toto program who had graduated and were inserted back into the wider community. And this training was conducted by professionals, and it took over a month. A comprehensive full-time program for 4 days, and then after that, mentoring. The selection of the candidates, even though they were our own graduates, was a competitive process, and it followed a set of criteria. The peer should be above 18 years, have good communication skills, must be virally suppressed, and be a role model. After training, the peer educators are deployed to the 8 Leototo centres where they work for 2 days a week. And their roles include psychosocial support, support groups, entrepreneurship training. I'm sorry, I cannot read my slide fully. Next slide. Then the training of the caregivers. As I told you, these programs are in the informal communities surrounding the city of Nairobi, where the majority live at the poverty level or below it. So we wanted to train these caregivers to build their capacity so that they can take a leading role in instilling good values to their children before, during, and after adolescence. So the trainings were conducted by counsellors, mentor mothers, and other Leototo staff, and targeted all parents and guardians with children enrolled with us, aged between 10 and 19 years. Trainings are guided by a curriculum. We started with Shujaa Teen Manual, but we then developed our own. Next. Then the comprehensive life skills training. We incorporate sexual reproductive health and rights and sexual violence against children education, as well as other essential skills such as negotiation for support, communication skills, children rights, and self-awareness. The trainings are conducted by counsellors, peer mentors, and other Leototo staff. And the trainings are guided by Leototo life skills curriculum, targeting specific age cohorts, 10 to 14 years, then 15 to 17 years, and finally 18 to 19. Next. Mentorship and rite of passage. The program encompasses appropriate rite of passage for both boys and girls aged 13 years and older. This activity is conducted annually and targets boys and girls who have completed Class 8 in primary. Training focuses on healthy relationships, peer pressure, self-awareness, and adjusting to secondary school life. And in addition, the girls are trained on menstrual health and hygiene, and the boys participate in safe and appropriate rite of passage. Next. And finally then, preparing them for transition to adult care. This involves preparing the adolescents from the age of 16 years for transition to adult clinics. It is a team effort involving the Leototo staff, peer mentors, caregivers, and adolescents. Smooth transition to adult clinics is promoted through counselling sessions, exchange visits, support groups, the OTZ clubs, and economic strengthening interventions, that is technical skills training, IGA, entrepreneurship training. Next. So what were the results? Adolescents make up 2/3 of children on care in Leototo, 1,815 of 2,824. So you see them there in those two lines. Next. So what was the viral suppression? result. We started in 2018 recording, and you see that in 2018, we had 173 males and 206 females who had viral load unsuppressed. But then if you look right up to 21, at this time, in 21, we had only 75 males and 61 females. Next. And suppression rate. In 2018, it was 81.2%. It then was in 1987.9, 2020, 91.1, and this time 92.9, almost 93. So we hope to be there even at 95 early next year. Next. So we conclude that the adolescent care strategy is significant in promoting viral suppression among adolescents living with HIV through the process that we lead them through. It is also found to be youth-friendly, participative, and results-oriented, especially as it utilizes peer mentors to address the fundamental causes of poor adherence to medication. Next slide. Thank you.
Okay, would you like to read your recommend? Okay, you're done. Thank you so much, Sister Mary. It's amazing to see the seed that you planted so many years ago bearing fruit today. And I think it's really a testament to your drive and determination. So thank you so much for your presentation. The audience, please continue to put your questions in the chat for the discussion portion of our session. Next, we will move on to Alejandro Cabrera. Alejandro, over to you.
Good morning, good afternoon, everyone. My name is Alejandra. Can you hear me?
Yes, we can.
Okay, wonderful. So hello from Guatemala City in Central America. Today, we're excited to share with you on some of the ways that we've leveraged social media tools for really targeted approaches to reaching young MSM, especially young MSM and other young key populations in Central America. Next slide, please. So very briefly, we are the Pan American Social Marketing Organization. We became a fully local organization in April of 2020, but we've been working in Central America for a little over 20 years. We have offices and health programs in 5 Central American countries: Guatemala, El Salvador, Honduras, Nicaragua, and Panama. And we are currently implementing PEPFAR and USAID's prevention services against HIV activity across 5 of the countries in the region. We recently became fully local, as I mentioned. We are now independent members of the Population Services International Network, and that allows us to work in other health areas, including gender-based violence prevention and stigma and discrimination, among others. Next, please. So under prevention services against HIV, which began in September of 2020, we're focused primarily on identification, diagnosis, and linkage of key populations and other high-risk individuals. In Central America, HIV is a concentrated epidemic, so we focus primarily on MSM and transgender women, and all of our efforts to complement what other partners are doing in the region are really focused on reaching hidden and other difficult access MSM, bisexual men, and other men at risk. And this is important because we're going to talk a little bit about targeted approaches using social media. Some other important things about the Central American region: we're relatively small across 7 countries. That's a population of around 50 million. As you can see, men are more affected than women, in our case, by HIV. And we have 4 countries with the highest prevalence in the Americas. And I also wanted to mention that internet access and smartphone penetration is relatively high for the developing world. Just to give you one example, Guatemala, which is the northernmost country in this map, has the lowest internet penetration in the region, and it's around 60%. And it's also a country where there are 2 phones for every adult. So right around 2012, 2013, there was a smartphone boom in our region with telephone companies competing to increase their clientele by giving them very basic smartphones with packages that included WhatsApp and Facebook. So internet access is relatively high in our region. Next slide, please. So I'm going to show you some examples on how we leverage social media tools to specifically reach young key populations. Okay, next slide, please. Something that has worked for us, and maybe it has been true for all of you, is at some point we all opened Facebook pages, institutional pages that talked about what we did as an organization or a project. But something that has worked for us is developing audience-focused social media strategies. So there is a digital brand with its own logo and its own strategy for different subpopulations. And I'm showing you 6 that we have here. And I'm going to give you an example in the next slide. But what's important here, and that's something that's worked for us, is that we've been able to better connect with each subpopulation or different sub-audiences by developing these audience-focused social media strategies. And each strategy with its own logo and presence in different channels will give us a guide on how we're going to communicate with our audiences through each of those strategies. So I'm going to show you what this looks like in practice. Can we go to the next slide, please? So this is what it would look like in practical terms. I'm going to give you the example of Versati, which is our digital brand for gay men in Central America. As you could see, the logo should be easily identifiable to a young gay man in Central America. Oh, this is a space for me. The name makes reference to a code word, a common word that used by this population in the region. The colors of the flag should be able to tell the person when they see this, okay, this is a space that I'm looking for, or this is not for me. Ideally, we want to be able to connect visually and in all terms of communications with key audiences. This particular digital brand has a Facebook page, an Instagram account, a Twitter account, and a TikTok channel. And that responds to the needs and the presence of and the preferences of this population in Central America. So the social media strategy will outline that brand personality and the guidelines for all the content. And what that would look like on the right-hand side, and it's pretty small, but I would like to explain, is that we do the planning, we do monthly planning on Excel spreadsheets. So we'll have the date of the post, the type of content that we're going to create, what the artwork should look like, what the text will look like, and any links or anything that we would need. And we plan it out for about a month or a month and a half on a spreadsheet. We'll review it with our social media specialists. And if we need technical review from our programs team for aspects such as PrEP or HIV testing, we'll coordinate that with their team as well, make sure that we have sign off. And once that is approved, then our social media specialist will design each of the posts with the artwork and the graphic design and everything that aligns to this social media strategy and brand. So this is what our planning would look like for each of the digital brands and subpopulations. Next slide, please. And then this is another example of how we can leverage social media tools. So for example, those of you that are familiar with TikTok or Instagram Reels will know what an unboxing is. This is a very popular social media trend used by commercial brands. They'll send social media influencers a package of whatever product or they would like them to test out. The person will record their own opening or unboxing of that package and explain how they would use the product. And that would help increase the access to that information to another population. So what we've done is, at least in these 3 examples here, we identified 3 social media influencers with varying degrees of popularity, we can say, from thousands of followers to tens of thousands of followers, or in the case of one of these young men, hundreds of thousands of followers. And we know that they are members of the population. These are young gay men in Guatemala. They also have, we make sure that they have an audience that is also comprised of the population that we're trying to reach. And we launched HIV self-testing in Guatemala and El Salvador last year. So we sent them HIV self-testing kit. So you can see them here. They're, I'll show you what they did with the unboxing of the HIV self-testing kit. Can we watch the video, please?
Hola, hola, si eres hombre te va a interesar este gran proyecto que está realizando Prisma y Versátil. Te cuento que Prisma es una de las alternativas modernas de realizarte la prueba del VIH desde tu casa. El servicio que te ofrecen es completamente gratis, confiable y muy fácil de realizar. El objetivo es para que tengas tus resultados rápidamente y en dado caso salgas positivo, puedas adquirir los medicamentos necesarios para poder controlar el virus y vivir de una manera más tranquila. Lo que me gustó que todo viene completamente sellado para poderte realizar la prueba de una forma más confiable. Aquí están todos los pasos que debes realizar para hacerte la prueba. Y así sucesivamente debes de realizar cada uno de los pasos que se encuentran en el instructivo para que los resultados sean verídicos. Aquí te dejo el contacto para que pidas tu prueba completamente gratis.
So I know this was in Spanish and many of you may not have understood, but I think what's important here is that when you give young people, when you speak to them in their, or you reach them in their spaces and you give them the opportunity to tell the stories the way they perceive it and the way they experience, in this case, an HIV self-testing kit, it helped reach a big group, a large group of audience that maybe we could not have reached alone. And we received a lot of requests for HIV self-testing kits and more information, and that helps broaden the reach of our messages. The last thing I want to mention on this slide is the example all the way on the right, is that in the case of Guatemala, where around half of the population is of the ethnic origin, Mayan ethnic origin, we also discovered, and we'll see in the results, that there's an important HIV prevalence rate in this population, and we decided to develop TikTok videos in Mayan languages for this population. So we're going to look at some of the results. Next slide, please. And we'll see it by the prevention cascade. So in this case, on the table on the top, what this tells us is that we're performing at least up to, I believe, June 2021, around 31% of the tests that we were performing as a project were being performed in young people ages 15 to 24. And then in terms of the positivity, there also 31% of young people were also represented the percentage of HIV positive cases that we were identifying. So we're finding a positivity rate of 4% in ages 15 to 24. And this responds in large part to the dynamic and the estimated prevalence rates in our region. But it was important for us to be able to track this because a very important percentage of young people were being affected. On the table on the bottom, as if you can read the line that says Maya, the Mayan ethnic group in Guatemala, as I mentioned, represents around half of the population, but we were finding a positivity rate of around 4%. So this gave us the input that we needed and motivated us to develop the TikTok videos in Mayan languages to reach young Mayan men, young Mayan MSM. Next slide, please. Our social media strategies also help guide our online campaigns. So what's highlighted here is that our paid advertising campaign on Facebook was helping us detect an HIV positivity rate of 5% among MSM in Central America. Next slide, please. And of course, we track social media indicators, including the number of messages that we receive when we're on air with an online campaign, what the engagement rates are like. We have Facebook impressions that measure up to 792,000 people. And we also track the numbers in terms of reach. And this just gives us an idea of how many people we're actually reaching and what that translates into the messages that become into one-on-one online interventions with our cyber educators and referrals to HIV testing services. So lastly, I want to share with you some conclusions and lessons learned. At least in our case, it's really worked for us to have these audience-specific social media strategies. And we think that interventions can be really effective in this way to help us reach and really connect with young people. Ideally, we would want for them to feel when they see the content, this is made for me, this was made by me, and feel connected to the messages, speaking to them, meeting to them where they are in the way that they would speak. And where possible, we also think it's really important to involve the audiences in participating in the development of those strategies. And we did that a few months ago when we were developing the social media strategy for young transgender women. And we invited a group of them in Guatemala City to help us develop the strategy. And that helped us define the pillars of content, because it's extremely important, when possible, to listen to young people when you develop this strategy. In this case, young transgender women. And when we talk about young consumers, how they consume online content, we also think it's important to keep in mind that they generally demand for very short audiovisual, fast information. That's why TikTok is so popular. You can give a lot of information in a very visual way in a short amount of time. But that also means that we need to be prepared to respond rapidly, because young people, when they see this, if you're going to generate demand, they will also demand an immediate response. So be prepared to respond to their messages as quickly as possible. And in general, just the need to be flexible. Any social media strategy, especially one that targets young people, it requires a lot of flexibility, innovation. You constantly need to be up to date with trends, moments, and memes, because this all moves very rapidly. So it requires the organization to respond rapidly, or the program or the project to respond rapidly and be flexible. So that I hope that what we've been able to share with you today can inspire, and we're also always open to listening and learning. Thank you very much.
Thank you so much, Alejandra. This is another amazing example of meeting young people where they are with strategies and approaches that appeal to them. And the use of technology in this way, I think it's really outstanding, and I'm looking forward to hearing more about the successes of your program. So I'd like to thank all three of our presenters today for these excellent examples they've given us, and the floor is now open for questions. And I do note that a few of you have placed questions in the chat, so we will get started. You can continue to add questions as we go through. The first question was for Ramona. How were girls at risk of GBV tracked and followed using your methodology?
Hi, thank you for the question. So at the moment, we haven't been specifically tracking that, but what we've suggested is that so that we can track the uptake of services, so whether it's post-GBV care or any related services, we would make like a attractive little referral slip that they could take with them to youth-friendly services, and that way we'd be able to track who accessed the service through accessing information from the library corner. And then for those who might not want to go to a clinical session or a clinical setting, we could also use the recommendation box as a way to, for an AGYW to feel free to ask for assistance and support from there. And in that way, through checking that box, we can be able to reach out to those at risk of GBV if they haven't presented those risks during life skill sessions or during safe space sessions.
Thank you very much. Our next question is for Sister Mary. And that question is, how have you overcome the age disparities of the mentor mothers and adolescents living in communities? The point being is that when, people live in small communities, they all tend to know one another. So the question is related to how open are adolescents with really sharing and expressing their issues, given that they're in the same communities with the people they're sharing with.
Thank you, Joanna. From the very beginning, when a child is enrolled in Lea Toto, the caregiver, in the early days, there were no parents who were living, but now with access to ART, more and more, it is the parent of the young person who is there, and he is a significant person. So we work with them right through all the time. First of all, obviously, helping them to understand what HIV is, and then they form groups. We also support them to help them to develop income generating projects. Because as I said earlier, when I was making the presentation, these caregivers are living on the poverty line or below it even, especially now with COVID-19. So we're there for them all the time. And so part of the training is to help them to understand adolescents. Similarly, when we are doing the life skills training with the adolescents, we talk to them about the role of an older person in their lives. It's not easy, I know that, especially if these adolescents their self-esteem is low or they're depressed in some way or other, but we work all the time to try and help. Have I answered the question?
Yes, I think so. Thank you so much. Okay. The next question is for Alejandra. And let's see. That question is for positive users, how is psychosocial support provided if necessary? So that's for Alejandra.
Okay, so I didn't mention this, but the social media team complements another team that we have in social and behavior change team. Their team is called the Cyber Educators. So these are peer outreach workers that have been trained to conduct SPCC through online channels. So as a social media and marketing team, what we'll do is generate demand, and that will transition into a one-on-one intervention with a trained peer. And that person provides follow-up to anybody, depending on what regardless of their HIV test result. And in case they are HIV positive, whether from a self-test or another rapid test, that Cyber Educators is responsible to provide follow-up to each user and make sure that they have access to linkage to care services. So we work together. We'll help generate demand, we'll structure the strategies, and then we'll move that to our programs team to make sure that person has access to a one-on-one intervention with someone who is trained and capable of doing that type of intervention, including psychosocial support. Thank you for the question.
Great, thank you. That's an important aspect of the work that you're doing. So thank you for that. The next question is for Verona again. How are you tracking AGYW participation in the Dreams Corners?
Okay, so at the moment, the tracking is a bit difficult because we're just using it by how much materials we provided and how many have been taken. But even in that, we can't really track, whether someone took more than one. The reason why we don't want for specific registers for people to be using that is because we would like for the spaces to remain their own and not feeling like they're being watched or knowing who is participating or who specifically might be able to access the information or the things that they might share there. Yes, so that is what we are doing at the moment. Thank you.
Great, thank you. Sister Mary, we have another question for you. How long was the mentoring of peer educators to ensure that they are skilled enough to deal with discrimination and other HIV-related issues against HIV-positive persons? So the first part of the question is how long was the training? And then there's a follow-up I'll come to after you finish.
Once we have selected the peer educators, we hold the workshop of 4 days. And then after that, we continue to mentor them until over almost a month, because we have staff in each of the centers who can assist them and help them to see how they will implement their role of mentoring these young adolescents who are in difficulty. The fact that the peer educators are nearly in peer with the adolescents that they are mentoring makes it easier, because they understand, because they've been through that situation of the stigma of HIV, the discrimination, all that area, and they've had to work through that so that they can understand them and help them to see, can they leave behind all those issues and see them as a valuable person, a beautiful creation of God, with the possibility of being able to dream their future and realize it.
Great, thank you so much for your response. The second part of the question is, how do you engage parents and caregivers in the transition to adult care process?
Yes, you see, these caregivers are in groups. They meet together as a group, and they are facilitated by some of our staff. We have a very interdisciplinary staff. We have a clinical officer, a nurse, a pharmacist, social workers, counselors, entrepreneurship, as social empowerment, nutritionists. So, and they meet once a week for interdisciplinary meetings. So we have that background there. And then they also meet with these caregiver groups as well. And those caregivers can express their questions and their experiences, maybe difficulty with their young person. So it's a holistic program, the Lea Toto program. So we're there for the caregivers very much.
Great. It sounds like they get a lot of support from one another, but also from a professional cadre of staff members as well. So great. Thank you very much. Our next question is for Alejandra. How do you monitor indeterminate tests?
So this question responds to many of the challenges that you have in general with HIV self-testing. The model that we use in Central America under our specific project is, we call it a hybrid model. So there's always accompaniment by one of these cyber educators, which I mentioned. So a cyber educator is a member of our programs team that's trained to provide follow-up to each of these cases, referrals to HTS and linkage to care. And then the case of test results that are inconclusive, usually what the user will do, or what we try to motivate them to do, is not just give an HIV test and end all communications with the person. This is voluntary, of course. If the person wants to no longer be contacted by anyone, they can choose to do so. But in many cases, including when a test result is inconclusive, they'll come back, hey, this is what it looks like. They'll send a picture, they'll tell us, what do I do now? And in most cases, what we'll do is refer to a confirmatory testing service to help them either become linked to care in the case if they are HIV positive, and if not, we'll provide follow-up so that they can repeat their test, whether through a rapid test or an HIV self-test in the period, whatever determined period of months that they would require after that. So there's always follow-up, and that door is always open. I think that's what's important. We allow the person to choose whether they want to contact us again, but we too try to motivate them to stay in contact with a cyber educator, and we don't want to lose them. So that's what we do.
Thank you. So back to Verona again, and this is another two-part question. Are the Dreams Library Corners put in schools attended only by AGYW, or are they mixed gender? And then the second part is, have you thought of looking for ways to extend services such as social and clinical services to boys to ensure that they are informed as well as supported?
Thank you for the question. The great thing about the library corners is that they are accessible. So in the schools, they are accessible to both, to all students who are in the schools. So yes, the safe space are the actual sessions that go on with a mentor specifically for AGYW, but having that corner and that space that is just in their library or in a classroom is accessible to any of the students, which is why we really emphasize collaborations with different organizations who some work with boys, others work with the LGBTQ plus community, so that we are not leaving people out in accessibility to services and knowledge that is relevant to them. Thank you.
Thank you. Back to you, Sister Mary. Do you have a record of post-support performance to ascertain if they have achieved the desired resilience? So I'll read it again. Do you have a record of post-support performance? So I guess, do you know how well the young people do beyond their involvement in the program? And do you know whether they have obtained the desired results? That's for you, Sister Mary. Your mic is not on if you're speaking.
Excuse me, I always forget. We have case managers, and the case managers are our social workers. And we have a database, which is very extensive. And we are under USAID, we're funded by USAID. So in that database, there's the whole record of how that child, young person, and then young adult, as they transition, is recorded. And of course, in-person contact with the case managers with their person, they also see that, and the counselors also will come in. And as I said, they have this multidisciplinary meeting every week, and these cases are brought up if they need attention, and also rejoicing in what achievements have been have happened. Is that answering the question?
Yeah, okay. and I think rejoicing is such an important point. We do need to really, celebrate our achievements and our successes as well. So thank you for raising that also.
And let me also tell you that part of our program for these who are transitioning is to give them life's economic empowerment workshops, so that they can then hopefully even start their own business or whatever else. Now that is a great support for the caregivers as well, who have been, as I told you, living on the poverty line and trying to feed these children, pay the rent, and to get them clothes, whatever else you follow. So there is that joy for the caregivers to see that their person now has become a young adult and is able, hopefully, to sustain themselves. Okay.
Great, thank you.
I could talk a long time, you know that. Yes.
It sounds like a wonderful program, and isn't it the goal of every parent to see their children be able to be independent and self-sufficient? And so it sounds like you're really helping them towards that goal. So thank you again. We have another question for Alejandra. Do young MSM in Guatemala fear any retribution or stigma for speaking out or posting about topics that may be considered taboo or against traditional cultural norms?
The response to that question is absolutely. In the examples that I showed on my slide, there's one particular young man in the middle picture who receives a lot of online and in-person abuse. And he speaks about it frequently. He has almost 500,000 followers on TikTok, so he's very visible. And anyone in Guatemala, which is a small country, around 16 million, and in urban settings, specifically in Guatemala City, generally knows who he is. And he talks about how he receives insults. People will scream at him on the street. And obviously that is accompanied with a lot of online abuse. But I wrote in a response in the chat to that, and I was saying that I think it's the work of a lot of activists and civil society organizations and other groups that have really pushed for human rights and visibility of LGBTIQ people, in addition to what our project does and a lot of other USAID funded projects do to help support creating a more respectful environment of LGBTI people in Central America. But yeah, absolutely. This is a region that experiences a lot of stigma and discrimination, especially these populations. And I also just wanted to mention that that's why it's important to create safe online spaces, a safe community. And that's why the title of the presentation is Comunidad Versátil. It means the versátil community, to create a community where I feel safe, where I feel seen, where the content that's being shared is for me, and I can laugh about a gay meme, or I can learn about gonorrhea. But creating these online communities that are safe spaces for populations that are highly stigmatized is also important. So thank you for that question.
Great, thank you. Okay, I see we have time for a few more questions. Back to Verona. There are notable differences between the Dreams Corners that are community-based and those that are based in schools. How often do you replenish materials? Where do you get materials from? And also, have you had any resistance to the nature of the subject matter, given that it is within the school setting? So I know that's a pretty loaded question, and I can repeat any part of it if you need to.
Okay, thank you. I think the differences that we've noticed between like in school or whether it's in community in the public library that we're in now, for now, because of COVID, there has been less frequency of the youth attending or going to the public libraries as there were more restrictions. So perhaps there'll be changes now, but with schools, we have seen more regular access or uptake of the, or taking of the materials or reading of the materials. And also, I think in the school system, we have better feedback from, you know, being able to interact or get qualitative feedback from other teachers or librarians or other staff members on how the students are interacting in those spaces and using the materials that are given. As I said earlier, I think there was a question about where we source the materials. So we work with different organizations that are in Botswana and in Gaborone to source materials that are related to youth. So we are really trying to strengthen those collaborations so that we are giving students access to holistic information that is also relevant for different genders and different sexualities as well, and different ages as well. And then how often do we replenish the materials? Well, because we work closely with the students who are in school and the schools, it's just on a need basis. So when we see that they're going down, then we will put more there. I think I answered all of them.
That's great, thank you. So we have our last two questions. So one for Sister Mary. You mentioned the Rites of Passage program. Can you say a little bit more about that and what components are involved?
Thank you. Yes, we have the circumcision rite of passage for our boys from about 15 years. And we prepare them for it. And we have a workshop. And as part of it then is the circumcision. So we have medical doctors who come and do the circumcision. And then we have the facilitators who will be with them afterwards to, you know, as they claim now their new role in society. So obviously the caregivers, you know, give permission for the boy to be circumcised. And again, because the boys are living with HIV, it has been identified through research that the chances of their passing the virus, if they have been circumcised, is 60% less. And that information is being passed through the cultures where circumcision in Kenya is very significant. And so that is gradually being seen as something that is a natural source of the circumcision.
Thank you very
Is that
much.
enough?
Yes, thank you. Thank you.
Okay.
Okay.
Yes.
And we have the last question for Alejandra. Can you say a little bit more about how you identify the influencers and how do you get them to engage with you in this way?
So what we generally do is first, depending on I'll give you the example of HIV self-testing. So the first thing that we needed to identify was list the people in Guatemala who were highly influential, people with thousands to tens of thousands to hundreds of thousands of followers. And then you filter that list to make sure that they represent and they speak to the target population, in our case, young gay men. So that would be an additional filter. We know that there's someone who are part of the community and they also speak to a large part of the community. And then of course, begins the process of outreach and negotiation. Not everybody is open to, something like this. We'll look at their online content and make sure that they're not someone who abuses others verbally through social media or doesn't express negative opinions about his own community in this case. And then we'll reach out to them and see if they're interested in receiving it, if they'd be open to it. A lot of social media influencers charge. That's part of their way of living, their business. They'll charge for these types of things. So being able to talk to them about being a nonprofit organization, that this is a project that is in benefit of the health of their community, and seeing if they're open to it. So that would be the final filter, would be seeing if they're open to participating and supporting us in this way. So I hope that helps respond to that question.
Yes. So I see we are at time. I want to just thank all of our presenters. You all have really been amazing and you're doing great work. And we certainly wish you all the best in your continued efforts. I'd like to thank our audience who has been so engaged in the conversation and for all the great questions that they have posed. I'm sure you will receive copies of the slides afterwards and with contact information if you'd like to get more information about any of these programs. But again, we just like to thank you so much for both our audience and our panelists today. Lindsay, any final words from you?
No, thank you very much to all of the speakers and Tijuana for moderating such a wonderful discussion. For the rest of our participants, we will be picking up in about 10 minutes for our special session with